What is tinnitus? Understanding the real symptoms. Imagine hearing sounds that no one else can hear, like ringing, buzzing, or humming, and wondering what's going on. That's what tinnitus is. It's not a disease but a symptom that something else might be affecting your hearing system. Tinnitus can be constant or come and go, and the sounds can be loud or soft, high or low. People often describe it as ringing, but it can also be like a whistling, roaring, or humming noise. The key thing to remember is that tinnitus is a subjective experience. That means only the person experiencing it can hear the sounds. In rare cases, a doctor can detect the noise using special equipment, and that's called objective tinnitus, but most cases are subjective. Tinnitus usually happens because of damage or changes in the inner ear or the pathways in the brain that process sound. The most common cause is damage to tiny hair cells inside the cochlea, which is part of the inner ear. These hair cells normally turn sound waves into electrical signals that the brain interprets as sound. When these hair cells get damaged from aging, loud noise exposure, or other factors, they might send abnormal signals. The brain then perceives these signals as tinnitus. Other causes include hearing loss from aging or noise, ear infections, or blockages like earwax buildup. Head or neck injuries can also affect the nerves or parts of the brain involved in hearing. Certain medications, such as some antibiotics, anti-inflammatory drugs, cancer treatments, diuretics, or antidepressants, can make tinnitus worse or cause it. Medical conditions like Meniere's disease, temporomandibular joint issues, high blood pressure, anemia, diabetes, thyroid problems, or blood vessel issues are also linked to tinnitus. Stress and trauma can make symptoms worse too. Tinnitus can be temporary or last 4 years, and its severity varies. Some people might only notice it occasionally, but for others, it can be very distressing. Persistent tinnitus can interfere with concentration, sleep, and overall quality of life. Because tinnitus is a symptom, not a standalone disease, finding and treating the underlying cause is important. Management strategies often include hearing aids, sound therapy, stress reduction, and addressing medical conditions that contribute to the problem. From the perspective of hearing health, tinnitus is closely connected to damage in the auditory system, especially sensorineural hearing loss. If you experience tinnitus, it's important to see a healthcare professional for a proper diagnosis and personalized treatment plan. Remember, each person's experience is unique, and managing tinnitus often involves a combination of approaches tailored to individual needs. Always consult with a qualified healthcare provider to explore the best options for your ear health and overall well-being.